everyone, thank you for joining us. It is July 1st. We have made it halfway through 2020, but COVID is still here. So today we're going to dive into what we can do to stop the second surge from becoming bigger than it needs to be with July 4th coming up. We're going to talk to some of our providers about what they've seen, what they've experienced, and also what they think is to come. And to start us off, we'll go to Lee for the stats to see why this is really important.
Very important, Sarah. We are up to 17 per day positives. So again, mostly outpatient. Our hospitalizations would not be up that significantly if it were not for one outbreak we have in a personal care home. And we've got here today with us Dr. Babar, who runs our critical care pulmonary department. Actually also going to be our incoming chief of staff next year. And we've also got Buddy Gager from one of our ICU managers here. Appreciate y'all being here with us today. But that is the good news that we're seeing is it's mostly outpatient, not as much hospitalization required, and it seems like that's largely because it's a lot of younger people. More than half of the people in our last batches of testing are under 40. Have you noticed that in what you see, Dr. Bob?
Yes, you're right, Lee. It is the younger people who are testing positive, but as we discussed, it's the older people who are coming into the hospital. And what's probably happening is that the younger people are transmitting it to their friends and relatives, and they are probably transmitting before they get tested. So even though they take precautions afterwards, it may already have been transmitted to someone.
Right, and like we said, the younger people, I've heard Sarah say, they try to fight through it. Oh, I've just got a little cough, a little cold. It's not like it used to be. This is a new thing where if you guys have a symptom, you normally don't have sinus problems, or you notice a little cough, you've got to isolate. That is so important. Obviously wear the mask and stay away from your older, more vulnerable people, but the main thing is isolate yourself. We can't emphasize that enough. Another statistic in these younger people that we noticed today looking at the data is the BMI. You want to share about what we've seen there a little bit?
Yeah, so the BMI or body mass index, which is an indication of obesity, is something that we've noticed plays a major role. Now, we've looked at our group of ICU patients, and we observed there that there was a clear correlation with the more obese you were getting, the more likely you'd end up in the ICU on a ventilator, and unfortunately also have a higher risk of dying. And today, Lee shared some data which is across a much bigger portion of patients, and it kind of shows the same thing. So I think that obesity is playing a major role along with other comorbidities like diabetes and hypertension in our patients.
Speaking of ventilators, Buddy, running the ICU, you guys haven't seen a huge spike in the ICU, which is good. The acuity's lower, as Dr. Barr would say, but how are you guys faring down there? How many do you have in your ICU in your unit right now?
Well, we currently have one patient in that ICU.
Okay, well, that's good. That's better than 6, right?
Yeah, absolutely.
And how are you and the team holding up in that?
We seem to be doing well. We were more prepared this time. It's the second wave, so we had plenty of times during the first wave to get our act together and know how to better treat these patients and how to take care of their needs and better use of our equipment and wearing our masks and just being more diligent.
Yeah, how the staff, now that they're more accustomed to COVID, it's a little more routine, I guess, than it was when we had the very first patient long ago. This is sort of become the new normal, should I say, I guess?
We would hope that that's not the case, but
forever.
That happens in medical care from time to time anyway. You see a rash of things come about and you adjust and you make adjustments, and it becomes the new norm until it goes away.
Would you or Dr. Babar want to share a little bit about the new, like remdesivir and maybe new things you're doing that are the latest? Is it something, would you mind talking about that briefly?
You're probably more versed on it than me.
So certainly, remdesivir, we are fortunate that we have a supply of remdesivir available to us. A few selected hospitals in Mississippi have it. So we are giving it to patients whenever we can, patients who meet certain criteria, based on the articles that have been published up to now. The other thing we're doing is we've been giving steroids along with remdesivir to our patients. And there is some preliminary information that this really helps patients as well. It's too early to say, but we have observed that our patients are doing better with this combination than they were without it.
That's great. That is more good news in a world full of bad news.
Yep, and speaking of articles, I know that your team, as well as our contact tracing team, is working on putting out a journal that should be, I guess, released to you guys sometime in the near future. So talk about a little bit of that contact tracing. Are we still able to use that now, that second surge that we're going through?
We are. So he could comment on that. He's the master of writing this, but actually we're going to put, not the one for the medical journal, we're going to put more a layman's edition out possibly within the next 24 hours. It'll be on our website and Facebook. Sarah can direct you there, but we will share a little bit about some blinded cases that we've done and what we've seen in our contact tracing. So we'll share more on that through the article or maybe tomorrow or the next day. But the thing I would tell you that generally speaking, of late, the most recent cases, we still see people mostly getting infected from their friends and family. The most dangerous people are people that you know. When you hug them, when you kiss them, we've had instances of that. You know, when you share a serving plate, those sorts of things are dangerous right now with family that might have even the most mild of symptoms or even be asymptomatic. You've got to be more careful in that regard, and we're asking people to do that. As far as the workplaces go, we are seeing a few workplace infections, but it's usually people that are working in very close quarters and not washing their hands frequently. So you got to remember to do that, and just don't touch your face, wash your hands, and be focused and careful, and don't stand too close to someone also. But speaking of concerns and the contact tracing, a lot of what we've seen lately is from Memorial Day. You know, there's a lot of contact during Memorial Day.
And with that, I would say, you know, if you're worried about the Memorial Day spike, I think 4th of July is going to bring a little bit more of a fireworks theme as far as spiking cases. And you know, you speak to that, Dr. Babar. You know, what do you expect to see?
Well, if we're not careful, we're going to see a worsening of the situation we are already seeing. I think what we're seeing is a follow-on from Memorial Day. Right now, we are still not seeing the number of patients in our ICU that we were back in March, April. But if we're not careful over July 4th, we're probably going to see the same numbers coming up.
Right. So now
It's really up to us. And remember, it's going to be the vulnerable older people. It's not going to be the younger people who are going to end up in the hospital. They're just going to give it to people, their loved ones, who will end up in the hospital.
If there ever was a time in the world to think about other people, to put other people first, with all the things going on in the world, if you could do one thing to help humanity, think about those vulnerable people. If you're a person under 40 and you're thinking, oh, I don't need to worry about myself, that's true, you might not. But think about your grandmother and your grandfather who might get it from somebody that you inadvertently infected. We don't want Buddy to get all filled up with a bunch of patients that he doesn't have to. I mean, we'll take care of him, we'll do our job, but we don't want Grandma to suffer.
No, we don't.
So tell us what from your perspective, what are your thoughts to get people on tightening up right now?
I know it seems like we're beating a dead horse every time we talk about this, but wash your hands, don't touch your face, isolate. Most importantly, wash your hands, wash your hands.
Yeah, it sounds so simple, but people don't do it, especially at work and in their homes.
Absolutely.
So with that, I think we'll wrap it up here, but there was one thing we were talking about earlier. We have developed, you know, everybody's out there doing, we see people shaking hands still so much, and it's our culture, it's a thing we do. Hugging, we hug in the South, but we've developed a little thing, we call it the Singing River Salute that we do now. And you don't have to touch. Buddy, you give a Singing River Salute? There you go. Stay Singing River strong. Give us one, Dr. Babar. Come on, Sarah, give us a salute. Look, you don't even have to touch anybody when you do that. Stay Singing River strong.
Singing River strong.